Hi, I'm Dr. Chase Hayden from the Hayden Institute, where we help our patients to be healthy and well without the use of drugs and surgery. As you saw in our last video, we're doing a gluten sensitivity series. What that basically means is we're going to touch on multiple different topics to see what is gluten sensitivity, how it affects our lives, what type of symptoms we may have because of it, how are we tested for it, how do we treat it, and what can we do in our lives to feel better, basically. So gluten sensitivity is a common condition in America today. 1 out of every 120 patients has been diagnosed with a condition known as celiac disease, which is an autoimmune condition relating to gluten sensitivity, and roughly 1 out of every 20 Americans may have gluten sensitivity, according to some reports. So how do you know if you have gluten sensitivity? What are the common symptoms or trends that you may experience in your life? Frequently when we think of gluten, we think of digestion because of the heavy correlation between gluten and celiac disease. So of course, symptoms such as diarrhea, constipation, bloating, irritability, acid reflux, all could be related to a gluten-sensitive person. But that doesn't necessarily stop there with our symptom list when it comes to gluten sensitivity. Gluten has a heavy correlation between many chronic conditions, including conditions of the thyroid, conditions of the cerebellum, or the motor portion of the brain, conditions of the digestive tract, like we talked about with celiac disease, and other conditions of the skin as well. So therefore, if someone is having gluten sensitivity, there's a possibility for a wide variety of symptoms. Headaches, movement disorders such as tremors or walking like you're drunk, ataxic gait, thyroid disorders such as difficulty losing weight, autoimmune thyroiditis such as Hashimoto's can be a gluten reaction, or can be associated with the gluten reaction. That's a better way to say that. So difficulty losing weight, waking up at night to go to the restroom, itchy skin, dry skin, nodules on the neck, swelling of the neck. When it comes to skin disorders, it could be related to rashes. There's a wide variety of symptoms that could relate with gluten sensitivity, in essence. So therefore, when we have symptoms, looking at the foods we eat is a great first step to overcoming those symptoms naturally without the use of drugs and surgery. And gluten tends to be the most common symptom, or the most common trigger to many of these symptoms. Once again, I'm Dr. Chase Hayden from the Hayden Institute, where we help our patients to become healthy and well without the use of drugs and surgery. And we look forward to seeing you back on our later gluten-sensitive series.